Selamat tengah hari Tuan Daim. Saya nak melaporkan ini part 2 my nursing process skills and supervision report at patient house with the family members, and I will discuss with you my nursing documentation. Introduction, we are all well known for home visit services. Among nurses, currently we are provided with talented good experience for any individual after discharge from the hospital. So, for example, accurate nursing roles, safe and effective nursing care outcome, the process involves psychological, physical, social, and spiritual aspects of the patient. We will look into it. The holistic guide format important for the patient to develop better understanding with the foundation process to build therapeutic patient-nurse relationship at home. So, it may be involved with the first impression, judgment using nursing assessment form to get required information as patient framework tools for home visit services. So, currently, with the systematic needs of a patient after discharge based on the healthcare foundation with nursing process, a therapeutic patient-nurse relationship could establish effective and impressive nursing assessment framework tools. It had to be done after determining the actual issues of the patient, not only any other potential issue for discussion with family members at home. For example, nurses can provide informative and effective holistic care with correct information about patient health progress to solve their family care problem doorstep at home, usually related to neurological assessment, medication alert, and dosage adjustment due to certain health signs and symptoms. The problem encountered for second opinion if away from the hospital area. So there were 5 types of patient categorized for the best value of nursing education at home. Firstly, the passive dependent patient. They trust doctor and nurses for healthcare planning decision. Another one is open-minded exploring patient. They trust doctor for medical condition, alternative treatment, and medicine with high emotional support. So for this patient, we are not sure which category are they, but if they contact you to aim for the second visit for nursing services, it will be helpful for you and the other team, whoever is going to the patient house after this. So another type of a patient is always question the doctor, is independent, skeptical. This type of patient don't accept recommendations, seeking for second and third opinion by rational statement and their knowledge level. So I think they will be in category 3. Number 4, types of patient is always search for literature review to perform care intellectual researcher. This type of patient desire a scientific explanation for every piece of information required. They check doctor comment on scientific value of each studies from any situation, from any institution. Type 5 is to choose doctor based on availability. So expedient, flexible, this type of patient will cost conscious too, as flexibility attitude to choose any physicians. The objective is to apply requested nursing procedure for close observation and specific health problem according to prescribed treatment at home. Problem found according to the result from general nursing assessment. Firstly, risk of fall related to finger stiffness and pedal weakness to stand after partially recover from neurological condition in the hospital for a long time. Risk for cardiac arrest condition at home due to tachycardia episode on assertion after each activities. Targeted outcome for each nursing home visit to achieve stable cardiac output and vital organ function with suitable medication and clinical prescription. Currently, to hold unnecessary supplement, food intake, and drugs prescribed by the cardiologist if symptoms persist at home for immediate checkup with the doctor. So this is under advice and monitoring. Even for the second visit, if they request from our company, so we should advise our staff to look into this. Safe mobility function at home after intervention of fall risk prevention management at home. In future visit, the health progress at home important for observation and evaluation according to nursing care and updated nursing assessment finding. Barriers to standardization purposes to avoid difficult implementation for any complexity of nursing procedure, although it may affect cultural differences and willingness to adopt standardized procedure, to highlight about limitation in home setting, lack of resources, training, equipment, and staffing, to change nursing procedure and practices by establish the new implementation based on resistant issue in nursing procedure at home according to patient safety level. So we should be applying nursing care based on what is suitable with the patient at home. So we cannot be so strict compared to clinical area because this is home-based practice. Technology to improve patient care monitoring at home, coordinate patient to prevent misunderstanding at home, remote the patient monitoring through facilitating documentation, accurate nursing procedure to perform. So basically, we are allowed to contact the private nurse in charge if they ask the services from our company to talk to them in private to guide them at home. so that they gain more confidence and they will look for our nurses lah, Tuan Daim. Comprehensive patient care to remote monitoring at home. Since COVID-19 pandemic in 2019, the risk of complication either high or low risk for those with self-isolation to clear up from infection disease required connection in care at home. So medical technology or devices were sent to the patient's home to remove patient vital sign and disease progress by symptom. For example, is the oxygen therapy equipment lah, the portable oxygen. Nursing assessment finding at home was identified helpful to screen patient every day. Those data were monitored regularly to connect the patient with specific disease progress by its health goal to manage its recovery process. The description about the disease progress, important to report about new or worsening symptom if involve any of the patient vital sign parameter when out of range, when the need of nurses to remote patient monitoring at home is possible. So the remote monitoring nurse will ask detailed information from the patient or family carers about blood oxygenation level, blood pressure, weight, and temperature to update the patient health progress and observe medical therapy at home effectively. Benefit for the patient to remote monitoring at home, it helps the patient to adjust chronic care outcome, for example, to do tracking on patient with heart disease, diabetes, neurodegenerative diseases, asthma, hypertension, mental illness, infection, delay in mobility function at home. We can offer patient remote monitoring technology through such devices or equipment for monitoring procedures such as weight scales, glucometer, blood pressure monitoring device, heart monitoring device. That's why kita biasa tak supply semua ni because it's consider clean. Kita tak share dengan pesakit lain dan kita selalu encourage family members to buy on their own. So offer remote patient monitoring nurse to assist in treatment at home according to diagnostic findings such as X-ray and ultrasound, treatment with oxygen therapy, intravenous fluid with pharmacological management, and skilled nursing services which involve in-person care at home. Biasanya is by prescription which is stated on the discharge summary lah Tuan Daim. Dan saya ada perhatikan yang doktor memang request if possible to start oxygen therapy at home. Impact of appropriate remote monitoring for the patient at home is to improve patient safety and limit the exposure to hospital-acquired infection, prevent post-hospitalization syndrome in such condition, less decondition after prolonged bed rest or inactivity, and able to estimate risk of fall at home. To remote a registered nurse for a person for daily evaluation at home, those physical or cognitive impairment factors for detection of clinical deterioration during nursing home visit activities. To establish a database for monitoring record related to patient health status, health concern, response to illness, and the ability to manage their healthcare needs. So the nursing process characteristic yang kita orang practice, patient-centered to provide care with the respect and responsive to the patient as individual person and needs, preferences, and value, is patient's right to accept nursing practice to do engagement with healthcare setting. Number 2 is interpersonal. Nurse and patient both learn and grow due to interaction. Collaborative, nursing process function as effective communication process to provide quality patient care with shared decision making. And fourth characteristic is dynamic and cyclical. Nursing process involve each interaction phases for the benefit of patient needs to provide quality outcome with nursing care. Number 5 characteristic is the develop critical thinking. Nursing process help nurses to identify which vital skills required according to each major health problem for care implementation intervention for the benefit of effective care outcome. So the nursing process step firstly is to collect data about the patient health status, systematic and continuous through head-to-toe assessment guide. Usually objective data which is measurable such as sight, touch, smell, hearing, vital sign intake and output, height and body weight, body temperature, pulse, respiratory rate, blood pressure, vomiting, distended abdomen, edema, peripherals, lung sound, crying, skin color, and diaphoresis. It's all by signs of measured data result. include any subjective data such as feeling, perception, thought, sensations, or concern that shared or verified only by the patient. For example, nausea, pain, numbness, pruritus, attitudes, belief, values, and life event perception or health symptoms concern. So ini semua kita akan lalui melalui interview session lah. So number 2, the nursing process step is to collect data about the patient health status, systematic and continuous through head-to-toe assessment guide, to assess patient difficulty through the verbal data such as slurring, tone of voice, assertiveness, anxiety, until cannot find the desired word to express idea. So to observe patient behavior, effect verbal message with words expression, their body language, general appearance, facial expression, gesture, eye contact, proxemics or distance, body language, touch, posture, clothing, or grooming style may indicate through non-verbal data collection is was powerful result to understand what patient really think or feel. Number 3, nursing process step is sources of data to collect from primary, secondary, or tertiary data from the health interview, physical examination, and nursing observation finding. Primary data ialah history from patient only with subjective data on behavior and emotion issue. Secondary source is history from family members or significant others of patient who cannot speak for themselves as frame of reference, usually among child age or previous patient health record, which is discharge summary assessment data from other nursing team or healthcare team. Tertiary sources is information from the textbook, medical or nursing journal, drug handbooks, surveys, and policies with procedural manual. Nursing process step 4 is fundamental of nursing documentation skills. Health interview approach, conversation with a purpose to obtain information, to provide information, to identify problem of mutual concern, to evaluate change required for better home living, to do teaching about nursing procedure at home, to provide caregiving support for patient at home, nursing assessment, build rapport at home, to interact with the patient. Physical examination approach refer to the patient health history, family history, general observation, accurate nursing diagnosis, planning and better intervention and evaluation. Observation through selected 5 senses of nursing assessment tool in use such as sight, touch, hearing, smell, taste is to understand patient health issue at home. It may include characteristics such as patient appearance, functioning, primary relation, living environment influences factor. For example, a nurse can auscultate patient lung to hear and listen to the abnormal sound, feel the heart rate rhythm, and able to identify palpable skin deformation. So number 6, nursing process. The step is fundamental of nursing documentation skills as reference during evaluation, verifying data for validated information received by fact and accurate.